You're listening to The Health of Business, where we talk openly and honestly about what it takes to run a healthcare clinic business in BC and Canada today. I'm Danielle Boyd, and I'm glad you're here. Justin, welcome to The Health of Business. I feel like this has been a long time coming, and we've had a fantastic kind of preamble chat before we started to record, but I just want to say how grateful I am for you spending the time with me today. Welcome to the show.
Thanks, Danielle. I have been listening to your podcast since its inception, and I am so grateful to be here.
I'm excited. I feel like we have a lot to unpack today. We have a lot of really great topics, and obviously we've been chatting a bit ahead of time and have really developed some rapport here. So I'm stoked.
Me
I
too.
always open and give anyone on the show, I like to just kind of hear a bit of your background and introduction in terms of how you started off in the profession and how you came to create Chipperfield Mobile Physio and Wellness, CMPW, correct? Yes.
Thank you. Yeah, you got it. Yeah, thanks. It's been quite a journey for me. Definitely, I've been a physiotherapist for 27 years now. It's kind of hard to believe. Grew up in Saskatchewan, uh, but have lived in Vancouver for 27 years. And um, I've got three kids, age 24, 22, and 17. Been married for 28 years and started off my career as a physio working in the public healthcare system through Vancouver Coastal Health, and also worked a little bit in private practice and extended healthcare. So in the early days, just started out working in a lot of different areas around the hospital, and ultimately settled into working kind of more in the orthopedic outpatient department and hand therapy department at Richmond Hospital. So got tons of great experience there for about 15 years. And when my wife and I had our firstborn, Ewan, our son, I decided to take a part-time job at the hospital and leave my job at the clinic I was at. And basically, did the part-time stay-at-home dad thing for
Amazing.
quite a few years, helping to raise the three kids and just have some more stability at home. And then in 2013, I decided that when I'd always kind of been curious to start my own business. I read a number of business books, and when our youngest was in kindergarten, I decided to start my business, and it was a pretty hectic time. We got a puppy at that time as well. I think we got a puppy in September, and I launched my business in October. So yeah, I'm not sure exactly what I was thinking, but
Three kids, yeah.
being being a mobile business, like working from home, I did, and things were obviously really slow at the beginning. And so I did have a lot of time to spend with the kids and get the puppy trained, and before things started to gradually pick up. So
That's
yeah, that's just a
amazing.
little bit more about kind of my background as a physio and as a parent.
I love it. It's so interesting to me how many people have actually started in the public system and then moved into the private system and started their own businesses. Especially, actually, there's kind of a trend with mobile businesses. I've met a few clinic owners who went from, there's obviously a need that is being identified in the public system that is, offering mobile opportunities. Perhaps I think there's a gap that's clearly being filled, and I'm sure we'll dive into that a little bit more. But I'm curious, have any of your kids gone into the profession or into healthcare?
No, I wish. I wish. We've got, my wife works in healthcare as well, and we thought, oh, for sure we'll have some healthcare nerds. But no, they're all like more into like the arts and
Mm,
social sciences side of things. My son did work with us while he was in university for about a year and a half as a like client experience coordinator on like part time on Saturdays. And that was really fun. And
yeah,
it was really fun to work with them. Just couldn't believe um, how much he brought to the team.
I bet. I bet.
Yeah.
That's an amazing experience to have that.
Mhm.
Yeah, that's awesome. Okay, so 2013, you get a puppy. You decide to start Chipperfield Mobile Physio and Wellness. You have three young kids. Let's talk about what it looked like in the beginning. Like, how did this start? What was the gap that you had identified that led you to begin?
Yeah, I think you're exactly right. You know, when I worked in, especially in orthopedic outpatients, and we were able, it was a great place to work. I loved my job so much. But when we were discharging people, like we could never really see people as long as we wanted to because there was always such a big waiting list. And you know, we would discharge people and we would kind of give them a list of uh, clinics in the area where they lived or mobile clinics. And, um, you know, because I realized that sometimes people still had some mobility challenges. They might not be able to get to a clinic. So there was that kind of need for in home care. And I think we were really lucky in Richmond. Like they had a really good home care system, like in general, like the physio, the OT side of things. Was pretty awesome compared to some other communities. So I could see that people were getting some care, even like when they were discharged from the hospital with a knee replacement or hip replacement. They got to be seen a little bit in home by the team out there before they came into outpatients to see us. You know, we usually wouldn't get them in sometimes for like 4 weeks or so. So I could see that there was like a value there. And then I'm not sure from there, I guess I just decided that I had worked at, you know, in a private clinic and I I really enjoyed it. Like it was fast paced. I learned a lot. I had great mentors. But even at the clinic and at the hospital as well, like the volume of people you see in an hour was pretty high at that time. I think it's shifted a little bit now over the years. It's like 25 years ago. Um, and just being able to, you know, have a little more flexibility in my day-to-day schedule, like, it's kinda what drove me more towards going the mobile route versus the clinic route. You know, just being able to have the, flexible hours where because I was kinda my wife's job wasn't very flexible at all. She had, like, worked full time, and so I was able to kind of structure my day when I started out to be like dropping the kids off at school, like helping them with their morning routine. And then I would just work from, you know, 9 to 3. And sometimes I might only have like one visit or two visits, but it was okay because it was like a little bit of extra cash
Yeah.
and I could still pick up the kids from school at 3 and it just worked. It worked well for our family in the early days.
Yeah, a lifestyle move for sure. Yeah, I get that. The mobile like, having full control over that schedule and when you say yes to these appointments, I think is huge. I'm curious about the logistics of all the timing and everything at the level the operation is now, but we'll keep it in the early phases for this moment because I'm sure that's a whole other ballgame. So yeah, so at that point, you know, you're kind of starting, you're building, you're doing these like here and there appointments. How did it start to grow? And at what point did you realize, like, boy, I've got actually something really valuable on my hands here?
Yeah, it's a great question because I'll just be like honest, full disclosure. I really didn't have too much of a plan. It was almost more about just like, I'm kind of curious about this. I'm going to just give it a go. Like, give it a try. If it doesn't work out, it's not the end of the world. I got my job at the hospital. I love my job at the hospital. So I kept my day job, so to speak. I was working at the hospital 2 days a week, and then I was doing the mobile 3 days a week. And um, I think what happened was the word started to get out in our neighborhood a little bit that I had started a business. So next thing you know, I'm seeing people out of my basement, and then I'm like setting up the garage. I set up. I mean, it was a beautiful brand new garage, but still, I'm like seeing the neighbors out of the garage, and then I started getting requests for neuro cases, and I had had a little bit of experience in acute neuro the hospital, little bit of neuro rehab experience, but in the outpatient department that we worked at, we we only saw like the really high level strokes that just needed kind of like a check in and maintenance plan. So I didn't really feel confident charging people good money without having some solid courses under my belt. So I was really fortunate to bring on one of the physios from the home care system in Richmond, Julia Dare, and she started with me. Her passion was in neuro, so
Amazing.
honestly, she 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 built up like the neuro side of things, and I built up kind of more the orthopedic side of things, which is more my background and comfort zone.
Amazing.
And I think once I brought her on, and we were both pretty hungry, and as momentum started to gain and we started getting busier and busier, I was like, "Oh my goodness, I think this might have some potential." I think that was probably the stage, and then of course I had to look at setting up a proper corporation and all that.
Yeah. Yeah, you have to almost, like, reverse engineer it at that point. You're like, "Oh my gosh, we're growing. Now what?"
Yeah, I still feel like sometimes we're reverse engineering things, 13 years later, but
Hey, that's how
yeah.
all good businesses are constantly, reinventing and reevaluating and shifting and refining. I think that's a really good sign if you're continuing to reverse engineer things. I certainly am, that's for sure. So at that point, you kind of realized it clicked. You're like, okay, there's something here. Now it's time to, put the proper systems in place. What did the growth look like beyond that? What's kind of like the next few years look like for the business?
Yeah, those were some of the most challenging years, to be honest, because I was still working at the hospital. I was part-time stay-at-home dad, with a lot of responsibilities there. I was carrying like, pretty much 3 full days a week caseload on the mobile side. And, you know, also I had this vision of having a multidisciplinary team. So we started to bring on other disciplines like kinesiology, rehab assistant, registered massage therapy. And so it was also just like a lot of learning on how that all works and fits together, and um, the legal and regulatory side of things in that regard, as well as just managing more people.
Yeah.
It was challenging times because I still really wasn't. I mean, things were picking up, but I wasn't able to pay myself enough money to really hire stuff out, if that makes sense. Like I was still doing payroll, all the billing, like the marketing. I did get some help with the website. I don't even think I had social media at the time. Like it
Yeah.
was a lot of balls in the air.
And as the owner, you're the one doing them all. You're the one juggling all those balls yourself. And you're right. Like, it's one thing to hire a practitioner because usually, the income is split or however you've structured it. But to hire an administrator that's just like pure expense. Like
Yeah.
I mean, obviously you can buy back a bit of your time, but it's a huge risk as soon as you bring that level of staff on. Yeah. So I mean, obviously you have now.
Yeah,
how
definitely.
how did
That's such a, I mean, it's such a, when you think back on it, it's like, even just when I was able to bring on, like, one of the first people that I brought on, we just did an ad on LinkedIn for like a billing coordinator, like literally just someone that could do the billings, because that was starting to get too much for me. And I don't love it. And I wasn't very good at it either. And, I didn't want things to start falling through the cracks, and just someone who could do payroll or even do the books, like a proper bookkeeper, like so many things. Right. And I was really fortunate in the early days because my mom was a retired nurse, and she moved out from Saskatoon to Vancouver to help. I was like, we needed help with the kids too, because I was starting to get busier with the business. And so we literally asked my mom, like, can you move to Vancouver? And that was such a huge help with the kids. And she started, answering the phones, and it was amazing because she had that nursing background, and, she could just do it from home. Um, all the tools and stuff that we use were all online. So
Yeah.
she was able to be a massive help from there,
Yeah.
from
Oh,
that
that's
point of view.
huge. That's huge.
Yeah.
Well, and I'm curious too, because so you started in 2013. At that time, like, I'm trying to remember, like, what was happening in my life. I was in physio school at that time. Like, there was no Slack, there was no Jane, there was no like, some of these online tools that have made, more remote work from home work so much more viable. you started it, like, this is like the OG of like, work from home mobile business, and you didn't have a lot of those tools. Like, at what point did you start implementing them? Were you doing like paper charts at the time? Like, what did that
Yeah.
look like? And how have you switched to a more like,
Yeah.
software empowered business?
Totally. I know. Yeah, no, we were starting off with paper charts and at one point I had like another friend of mine from the hospital who had started a clinic in Richmond, and I would like still keep in touch with her, and she said, "Justin, like you gotta check you gotta check this out. Like I signed up with this company called Jane, and it's just been like a total game changer," because she'd been doing paper charts for about over a year as well. So I remember at the time, literally, get this. I mean, this is a shocker. So, I had a kind of another lady who was helping me with some like website stuff, essentially. Like she helped me to build and maintain our website. And we reached out to Jane and said, like, we're interested in signing up for this product. And her and I went to North Van and sat in the office with Allison, and she gave us a tutorial on Jane. Yeah.
That is like early adopter
Early,
territory.
I think, and at one point we reached out to them because we were having like a staff party, like our summer staff party, and I wanted to do like a contest, like a giveaway. And we are trying to think of like a fun question. And I thought, oh, I wonder what client number we are for Jane, because I know we were one of the first like OG
Sounds like it, yeah.
members. And so I reached out to them, and they're like, they looked it up, and you're like, yeah, you're client number 75.
Wow. You've seen
Yeah.
all the iterations, all the
Yeah.
you've been there.
Totally. So then the next step was to learn that, and luckily it was a pretty easy learning curve. And we had a pretty small team. We probably only had about 4 or 5 staff at the time. And
Right, yeah.
I remember though, like, what am I going to do with all these paper charts? So I hired a lady to come in to my house and scan paper charts for about 2 days and upload them all into Jane. And so yeah, that was kind of how we got going with that. And then fortunately, I had a friend who I had played some golf with and just, knew from the neighborhood, who was working for this company called Slack. And I was just chatting with him. He's like, dude, you gotta check this out. Like, it's pretty cool. So we got onto Slack again, like fairly early on.
Yeah. And those are the tools, like, so in, like, when I had my business as well, like, Jane and Slack were non-negotiables. Like, that was what allowed us to run a telehealth, like, based business, because how else do you bring all these people from all around different locations together? That's a really big challenge. So, obviously being an early adopter has probably contributed to that facilitation, but what an interesting, like, these tools empower more mobile telehealth based businesses so much more now, and we're seeing more of them like kind of pop up. But like, you were really one of the early adopters, early creators here, and like, I think that is just so cool. Okay, so you get Jane, you get Slack, you start doing this, and then the team obviously continues to grow. Like, you've implemented these things. What does that look like now that you've got these like tools and you've got more people? How do things look in the subsequent years there?
Yeah, I mean, things really, I think there was another big shift in about 2017 or so. I was still working at the hospital part time. I did have a little bit of help on the back end, which was like a massive help. I was still treating, obviously clinically full time in the mobile side of things. And um, we were getting up to a team of probably around 10 practitioners at the time. And, but I was, it felt like I had to well, I did have 2 jobs, but it felt like more than that. If if I guess it was like a 1.0 FTE, but it was more than a 1.0
It's
because
like
the
a
business,
1.7.
I was still wearing a lot of the hats. Like, I had, was fortunate enough to get help with some things, but I was still doing probably too much. And so, I mean, yeah, it was great. I could, you know, treat from 9 to 3, pick up the kids, have time with them, make dinner for our family, get the kids tucked in. But then I was working from like 8 to 1 or 2 in the morning. And that's when I was like, okay, something's got to give here. Like, I did that for about a year, and I'm like, I just started like getting really tired. And so I actually had to make like a really tough decision to leave the hospital.
Yeah. Yeah,
Yeah.
fair enough. Good for you. Yeah, they were probably that's I mean, that's a huge loss for them, but I think a huge gain for your business, and I'm guessing was a huge catalyst to, like, even more potential and growth. Yeah.
Yeah, it was a no-brainer, right, looking back on it, but at the time, it was, like, a pretty big decision because I had that kinda comfort and security of that job. I did really love working there, and I love the people that I worked with. But yeah, I had to kinda just make that decision, like, if I truly wanna grow this business to its maximum potential, I've gotta put all my time and energy here.
Yeah. Yeah, exactly. No, I think I mean, and it's always like hindsight's always 20/20, right? It's, there's all the factors that go into making that decision. And then once you've made it, you look back and you're like, yes, of course, this is the right decision. But I think what you've been speaking to, which I think is a huge lesson for so many people who want to open a clinic or have opened a clinic, is like you are very likely going to wear all the hats for a long time at the beginning. And to be okay with that, or to at least be prepared for that, I think is a huge thing that anyone who wants to open a business has to be okay with.
I think so. I mean, the good part about it is you really learn everything from the ground up.
Yeah. Yeah.
So that then when you do get into a position, and I think of it as almost like financially, really, like when you can afford to, bring on, I still remember when I brought on our second kind of full-time person and like what that was gonna cost me, I was like, "Okay, well, shoot, like I'm taking a pay cut, I guess, right?
Yeah.
Gotta come up with the money somehow." But,
Yeah.
I knew it's almost like, I don't know. I grew up working in, like, the restaurant industry,
Mm.
so starting at the bottom, like, as the dishwasher, moving up to prep cook, sous chef, breakfast chef, and then into the dining room, like, you learn
Yeah.
all the parts of it, and you have a greater appreciation for all the moving parts.
Totally, and you also yeah, exactly, like, the business from all perspectives and all facets too, like, I think that is super, super, super important. Okay, so it's around 2017, you leave the job. At any point during this process, did you ever think of opening a brick and mortar? Like, was that something that ever crossed your mind? Like, what was it about being fully mobile that helped you really, like what was it about mobile that made you wanna go down that road continually?
Well, that's a great question. The answer is yes. I almost did open a brick and mortar with two other ladies, one of the physios I was working with, as well as my accountant at the time. We did a lot of due diligence together. We did due diligence for close to a year together. Um, Things were looking good, but without going into too many details. And this is the great thing about doing due diligence is kind of on the 11th hour when we all sat down to hammer out the partnership agreement, the wheels fell off and it just didn't work out. Um, it was disappointing because I was really excited about it. The plan was kind of, I was going to run the mobile side of things. We were going to kind of
Mm,
incorporate Chipperfield mobile physiotherapy at the time with a clinic and, my other physiotherapist was going to run the clinic and then the accountant was going to kind of run the back end side of things,
mhm.
legal and accounting. And yeah, it just didn't work out. But I mean, it definitely was a really good learning experience, learned a lot. And also it just made me, there was something that clicked like a month or two after that where I'm like, you know what? I think I'm just going to stick with what I'm doing. Like what I'm doing, it's got legs. I'm enjoying it. I'm all in on it. And I'm just going to like, just stick with that. So since then, I haven't really entertained the possibility too much. I have been approached a couple times, but no, I'm just loving the mobile.
Yeah, and it clearly works, like, you found a system that works well, it's like, and you know it, like, you know it. Starting a brick and mortar now would probably be a whole new adventure, and I know you've had kind of a new adventure recently, and we'll discuss that shortly, but,
Yeah.
um, yeah, like, it feels like if it ain't broke, don't fix it at this point.
Yeah. And I think you also maybe asked about like what it was about mobile that I
Mhm,
was loving.
mhm,
I mean, there's a lot of things. I could really literally go on and on with a list, and I do have a list, but I think the biggest one is probably just the flexibility. Like I could still, even as a business owner, I could still kind of integrate. with slightly better ease, I think, than, the hours that you need to be at for a clinic sometimes, especially in the early days. They're typically kind of open 7 to 7 ish, whereas like I was open 9 to 3.
Yeah. Yeah.
And then I had staff that could work, the typical hours were more like 9 to 5. So even for like, when you think about having like admin staff, like I could have one admin staff on person for that shift. I
Yeah.
wouldn't need two.
Yeah. Yeah.
So little things like that. And also just, I realized fairly early on what really took me deeper and deeper into it was just the amount of time that I got to spend with patients. So, I
Yeah.
was able to, my model was the 60-minute one-on-one, and I'd never had that before. I didn't know how great it could be.
Yeah. Yeah.
And so that was another big one, is just that the sessions were generally, they just felt a little more relaxed. I could definitely connect with people, especially when you're doing like that subjective piece. Really, if I could sit and listen to someone for half an hour, and then I'm like, all right, well, let's see how your range of motion is, and let's do some treatment, and you still had a great session.
Exactly.
So, I mean, and it's just like, it's really a different environment. Obviously people, when they're at home, they do tend to be a little more relaxed. Like some people don't
Yeah.
love healthcare settings.
Mhm.
Um, And so, yeah, they're in a place where they're comfortable. I love that you would sometimes get to know some of their family members a
Yeah.
little bit. I'm a very social person and I love
Yeah.
people. So,
Yeah.
getting to know their families, and also just seeing how they move and function in their own environment, where their challenges are, looking at things like home safety, being able to make those changes. And also just like, I think for clients, the feedback that I was getting is that they really appreciated the convenience of it.
Mhm.
So obviously for some people, they truly were homebound, and they just, maybe even they lived alone, they didn't have family, they didn't have any way to access more traditional means of physiotherapy, like at a clinic or at a hospital. So, just being able to go to them, save them time. And also, I think like I've had a lot of people say over the years, like, it's really neat to learn how to rehab in your own house, because it's like, oh, that's where the TheraBand goes. Or that's where I can do those exercises like standing at the kitchen sink. And there's just something about it, I think, that for like compliance, um, that that works.
Yeah. It's so much more
And
integrated.
yeah, yeah, it's just very practical.
I love
And
that.
like, I don't know, I also love the fact that, while, yeah, driving can be stressful and challenging, especially more and more lately. But I didn't mind it that much. So like, just time in between clients in the car, like listening to music, listening to a podcast, listening to an audiobook, calling a friend or family member. Might have time to run an errand. Like, just loved that there was a bit of time to like decompress after
Yeah.
one session, and even like as you start to get up to close to your next home visit, you're thinking, okay, like, what am I going to be doing with Mr. So and so? And, okay, I'm going to keep going. There's so many more things.
Please do. Please do.
Like I said, I got a list, right? I feel I get really excited about this, but
I can tell you're
it,
very lit up, and I
yeah,
am too.
yeah.
I love it.
Yeah. I mean, like, so the other really neat thing is like, I mean, I'm not from Vancouver originally. So it allowed me, even though I'd lived here for many years and I knew kind of my neighborhood and the city fairly well, but um, when I started to, explore more and drive more into different areas of the lower mainland, it really allowed me to like learn more about different neighborhoods, or like cool coffee shops, or like, I love
Yeah.
food and coffee. So I'm like, where's my next
Where's
coffee going to
lunch?
come from? Like, where's lunch going to come from? And so just allows you to kind of, yeah, it's just, you're outside at times too. Like maybe you find yourself on your lunch break and you're like at the beach or near the forest, and you can just like decompress a little bit and take it all in. And then the other really cool thing is that you get to be like really creative with your sessions. So, this was especially became more evident in COVID, I think. We started doing a lot more sessions outdoors, like when weather permitted. So getting people outside of their homes, because again, a lot of these folks that we were working with were pretty homebound. A lot of times they don't have the confidence to even go out. They're like, I don't know if I can navigate my stairs. I don't know if I can navigate the sidewalk or a curb or whatever it is. So just getting people outside more. Um, and not only like walking in their own neighborhood or like maybe doing a little bit of exercises at one of the parks near their house. But also some of the coolest sessions I've ever had have been like, you often as physios, we want to get people back to doing the things that they love to do. And for some of our clients, they're still fairly active, but maybe they had a serious injury. I had like one of the most severe MVAs that I've ever seen, and we got him back to the driving range. Like, I had a couple sessions with him at the driving range because he wanted to be able to hit golf balls.
It's awesome.
Um, or like another, client comes to mind where, he really wanted to get back to playing pickleball. So I'm like, "Great, let's meet at the pickleball court."
Yeah,
And you can really just it's just so cool to be able to see people getting back to, like, doing
yeah,
things that
and
they're able to do, and they just
in
get
that environment,
so
and, like,
lit up.
that's something that, like, if you're in a brick and mortar and your schedule's, like, every hour on the hour, like, you'd never be able to go meet someone at the driving range or the park or the pickleball, like, that would not happen in that setting.
Totally. So, I mean, I could go on and on, honestly. It's just I just love it, and, that's kinda what really made me go like, "You know what? This is a good thing what we're doing here, so let's just keep
Yeah.
going on. Let's keep
This is
going at
working.
it." Mhm.
So, okay, so this is kind of around COVID now, like, you're definitely growing at this point. So what do the last few years look like? Like, because you have a large staff, a large team, many cities now, like, what has kind of the last phase of growth looked like for the company?
Yeah, it's been really, really exciting. I feel like, 2019 was really things really started to take off for us. And 2020, I'm gonna say was gonna be like our big breakout year. And then COVID happened and
Yes.
everything changed, right? Literally. We still had a fairly small team at the time. Fortunately, we were able to retain everyone on our team. Like everyone was
Amazing.
really patient with it. I had our full-time kind of office manager at the time. I was able to keep her on staff, which was huge. And and then, I think it was like a blessing in disguise in that when when we were able to go back into working in people's homes, and care homes and whatnot, I think our team was, like, really, really excited too. They're, like, obviously missed it. Like, they're just so ready to get back in there, and we actually started to get busier and busier, as 2020, 2021 kinda went on. Things really started to pick up,
Yeah.
and I went back into so much so that I went back into treating full time.
Wow.
Like that was how busy we were getting. I had kind of been doing 3 or 4 days a week, but I had to jump in like full clinical. Um, and then fast forward to 2022, and we were really the momentum was really strong. We had some really, really good success with hiring. Like I think there was a lot of movement during those kind of early years of COVID.
I think so. Yeah.
um, we
Agreed.
were able to, like, just be really fortunate to bring on, like, so many great people, like, so many great staff, and again, just growing that multidisciplinary approach. We expanded into, clinical counseling, mobile and virtual,
Wow.
and, speech and language pathology, and, some of the other like, acupuncture. We brought on, like, an acupuncturist and just some of those, other disciplines that we'd always wanted to um, bring on. So,
Yeah.
I'm a huge believer in that multidisciplinary model of treating
Mhm,
the whole
mhm.
person. And, while we don't do everything,
Yeah.
we do have 8 different disciplines that we offer. So just really growing that out gradually. And again, it's all learning experience, right? Like
Yeah.
I didn't know the world of I knew the world of physio pretty well and, rehab assistants and kins, but, getting to know what it was like working with clinical counselors was like a whole new
Yeah.
learning experience.
Totally.
So I think at the time I almost got back to that point where I was like, okay, I'm logging a lot of hours here. And if I truly want to keep growing this the way that I feel like the potential is, I need to step away from clinical duties more. So what
Mm.
I did is I gradually over time I just dropped a day a week. I went from like 5 days to 4 to 3 to 2, and then eventually I had to I made a really hard decision to step away
Yeah.
from clinical completely.
Yeah.
And because there was just, you know, by now we had a team of probably over 30 people,
Yeah. Wow.
and it was just a lot. Like, and
Yeah.
I'm a physio. Like yeah, I've had to learn how to be a business owner, but I felt like that was the best move for the business and
Yeah.
for myself.
Yeah. It's true. It's so interesting you say that, like, a lot of clinic owners who continue to treat often kind of end up almost becoming a bottleneck in your own business because stepping away and being able to work on the business versus in the business allows you to grow, in such a different direction sometimes, or just to be able to see things at 30,000 feet and create bigger solutions, bigger impact, and bring on more people and be a leader for those people versus having to be, like, stuck in the weeds of it, right?
Yeah, totally. Yeah, like in that time we developed like our whole leadership team, and like I was kind of in charge of that, right? I was like the person who was doing in the early days all the mentorship. When we had a team of around 8 to 10 people, I could handle all that. But once we started to get up into like 15, 20 people, it was just too much. So, definitely we've gradually brought on more and more people onto that leadership team so that everyone that joins our team is paired with a mentor.
Mhm.
So, we have like clinical neuro lead, clinical ortho lead. Got, now we have a clinic director, assistant clinic director. We've got a kin lead, a rehab assistant lead. And so, my kind of goal and vision is to have leads for each discipline and for our leadership team to like work together and grow together and learn. And essentially, one of my biggest goals is to just grow great leaders like within our organization.
Yes. I love that. That's really cool. And, like, you're growing people. Like, I think that's one of the coolest things that I think a strong leader wants to create other strong leaders and, create this system of just generally strong leadership. So I think the fact that that's what you've stepped into is huge. Kudos.
Thank you. I really appreciate that. And uh, it's always like such a learning curve and learning experience, right? But another really hard decision I made about a little over a year ago was stepping away from that, right? Like being like, okay, like I there's other you're constantly kind of going like, what is the best use of my time here? Like what value can I bring to the business? And I kind of got to a point with our leadership team where I'm like, I think these guys got that. Like they got this. Like they don't really need me anymore, which is kind of a hard to step out of things sometimes. Like it was really hard actually on that one, to be honest.
Yeah.
But just like having faith and having trust and just like, yeah, these
Yeah.
guys, these guys are awesome. And a lot of times when you step away from things, people are like gonna be better at it than you. That's another like piece of humble pie that you got to eat. You're like, I actually might not be the best person for this task or role or job.
Fair enough, but how incredible that you're able to even, like, see that and give them the opportunity to exercise that. Like, I think that's the humility in stepping away to allow someone else to really fully, like, flourish in that role, I think it's humility and leadership, really, like, knowing when we're not the best fit for, this role is actually, like, one of the biggest acts of leadership I think we can do.
Yeah. Totally, and and the thing is too is like when I started speaking with our even like our senior administrative staff that have been with me for a while, and some of our you know senior physios that were stepping into these roles, they wanted more responsibility. Like you know, they they wanted it. They wanted to like learn and grow, and so uh, I was really lucky.
Yeah. And it's interesting too, like, I don't think there's a ton of opportunity for physios to be in leadership roles often, like, unless you work in a health authority or, maybe in the school, or like some of the like big, LifeMark type clinics. Like, I actually don't think there's a lot of leadership roles for physios. Like, it seems like we either go down like clinic ownership role or clinical role. And so I think it's really incredible that you've even created these roles and opportunities for physios to step into more of a leadership director style role.
Yeah, that's really interesting. I don't know if I've ever had that thought and perspective before, Danielle.
Yeah, like I think some clinics have, usually like a director but it's kind of a split role or like I don't think there's this like career trajectory that clinics especially or clinicians especially in the private sector can, pursue a leadership role without necessarily being an owner. So I think the fact that you've even created these roles is really awesome.
Yeah, thank you.
Yeah, it's and like I think a lot of it too is like what you're talking to and speaking to is the humility of being a really great leader and being able to step away when, the time is right. And I think like a lot of clinics just never really potentially get to that point. Like having a mobile business almost allows you to scale at a point where like there's a limit to your scaling. Like whereas if you have a brick and mortar, you're limited to your space and time and the rooms and the schedule, right? Whereas with a mobile business, like the growth is infinite potentially, right? So that does create really unique roles within the system.
Yeah. No, you're exactly right, and that's why I'm so excited about it. Um and in doing so and in growing like that, I've really had to ensure that we have like a really strong org structure and the right people in place.
Mhm. Yeah.
Um I think it's like Jim Collins is like the right people in the right seats on the bus too.
Yes.
That's been a lot of learning of like just building out that org structure so that everything can flow and flourish and things run smoothly.
Mhm. Totally. And if you had potentially been like still treating 3 days a week, you may not have even been able to have the like time or ability to like have that level of thought process to go into it. So I think that's like
Yeah.
that's huge.
Well, yeah, totally. And this is the thing is that what I especially discovered when we started to really grow more, is that like hiring, for instance, right?
Yeah.
Hire like I mean, we're physios. Like I didn't have any training in hiring people, so I made a lot of maybe not great hires early on. I'm just like, I know you, you're hired. Like I like you, you're hired. Like.
Totally.
Uh, and some of those hires have worked out and are still with me, and some haven't. And you learn from those things. But I think the thing is that even if you just look at hiring alone, and if you really want to, because we've clearly seen that the demand is there.
Mhm.
The demand, like the number of new client inquiries that we get. So of course you want to try and do your best to get people in a timely manner and not run like waiting lists. So we really had to shift our focus to getting better at hiring, and that takes time. And so if I'm one of the people involved in that, then I need time to be able to dedicate to it properly. And if I'm like treating full time and I'm being a dad almost full time, like where do you do that?
Yeah, and, like,
And like
squeezing an
he
interview in between client cases and then not reflecting on it and, like yeah, like, rushing the
totally
process.
like
Yeah,
even just like doing things like reference checks, like take time. It all takes time. And it's usually during working hours that you want to be doing these things.
of
And
course,
so
yeah.
yeah, I just feel like something's gotta give it. Something had to give it at some point. And so being able to step away from clinical duties, even though that was like really, really, really hard. I mean, just to give you an example of the numbers, like from the time that I did that in 2022 and the 3 years that preceded, we doubled our gross revenue
That's
in 3
huge.
years.
There you go. Whereas
So,
if
I
you
mean,
just
I know.
stayed clinical, you would have just kind
Yeah,
of been status quo growth. Yeah. Like
sure.
that's yeah.
I'm one physio that could see maybe, 25, 30 home visits a week.
Yeah.
And by stepping away and setting everything up and hiring and setting up the org structure, we're able to literally, it sounds a bit corny, but 10x it. Like we've more than 10x'd it since I
Yeah.
did that, which is, I don't know, it's kind of cool.
That's amazing. Well,
Yeah.
congratulations. Like that. I mean, like I think you should be really proud of yourself for that. That's really incredible.
Thank you. And I mean, ultimately, what I had to keep in the back of my mind is that in doing this, we're serving more people.
Yes.
Because I'm like, we are offering a much needed service. We're delivering what I feel is like, raising the bar on delivering high quality healthcare in the community. And I want to do like more of that. So how can I do more of that? Like what's the best use of my time as a business owner so that we can reach more people and see more people?
Yeah.
And that's where like I think sometimes you gotta put your business owner hat on and take your clinical hat off a bit.
Yeah, and I
For
think
me
that's
anyways.
totally and, like, we're not taught a lot of this business stuff and have that concept innately within us, right? So, sometimes we have to, learn the hard way. Sometimes it, like, takes quite a bit of, like, shifting and changing and, like, evaluation to make decisions like that because they're not taught to us at an early phase of business ownership.
Not
Yeah.
at all.
No.
0. I mean, for me, I mean, I think like some programs in Canada now are implementing some business development and business acumen things into their
Good.
courses, which is great.
Yeah.
But I still think we could probably use more of it from what I know.
Agreed. Agreed. I'm curious about, like we've talked a bit about some of the challenges and like the more like leadership challenges. I'm really curious about like, because mobile is such a unique thing. Like, how I'm so curious about like kind of the nitty gritty of the logistics. Like, how do you book people? I'm guessing you probably have someone who is like in a scheduling, booking, coordination type role, but how does it work? Can people book online? How do you like, because you have to drive places. So you have to have enough time in between. Like that must have been a whole thing to figure out.
It is and continues to be. Yeah, it really is. It's probably like, one of the biggest challenges that we face. Um, we have the we have just an amazing admin team. We have 4 uh well, we have 3 full-time and 1 part-time people that are working in these roles of say like answering the phone and people booking people in or responding to email inquiries or contact form from our website. And one of the biggest challenges for them has been with a growing team and with, we're in, I think about 15 communities in BC now. And, you know, also with our expansion to Calgary recently, like looking at, staff who work part time in only certain communities on certain days. Uh, our team has done a really good job of building out like kind of a spreadsheet of how to help coordinate appointments, right? So it's actually something that we are continually kind of working on. We're looking at right now, like working with a company to help us build and use, say, like AI to help us improve our efficiencies
Mm,
on how, like, when we get an inquiry and we know they live in, say, Coquitlam and they want to be seen on Thursday. Okay, great. Who do we have in Coquitlam that works on Thursday that's available? Like little things like that
yeah.
that are challenging for them. So in general, like the mobile model, it takes a lot more time usually booking people in. Like, you're dealing with generally more complex cases,
Yeah.
like a
Yeah.
lot of like elderly, frail elderly. Often you're talking to their son or daughter or even grandson or granddaughter and
Yeah, totally.
trying to coordinate things. And they've got a story. They've got they've been through a lot. Like a lot of them, like, are we need enough people in the office that can like be on the phone with people for a while, essentially. And if another call comes in, we've got a phone tree. So on any given day, we've got 3 people that can
Wow.
respond to calls. So we've had to figure out kind of like that back end phone system as well. So that because we really believe strongly in like answering the phone.
Yeah. Yeah, and especially
So
if you're dealing with that older population, that's how they communicate. Like, they're not gonna be doing online booking as much as, like, it's a little bit more old school.
yeah. Yeah. So for to answer your question on online booking, like too, that's the other thing is that it's so hard. Like
Yeah.
we like for our clinical counselors that do virtual, I think we're doing some online booking because it's more just like their schedules are set. But for mobile, it's really challenging and there's no tool, say in Jane
No,
yet that is like I keep thinking like you gotta use software like AI to figure out. So we're kind of working on trying to figure out our own thing, to be honest, and like how can we develop our own tool to help our team on the back end with these types of things. Um, and so I think that's what's next for us is figuring that out.
that's cool. That sounds like a
Yeah.
really great use case of AI, actually. That's really interesting. I'm very curious to see how that all comes to be. Um I wanna so you mentioned Calgary. I really am curious about this expansion because, obviously, you've been working in BC, you're in several communities in BC, and recently you've expanded into Alberta, into Calgary, and, we were kinda chatting a bit before the recording about how it's a whole new market, but it's also a completely different, like, regulatory and insurance landscape as well. Like, I'm so curious about what made you want to expand there and how that process has been.
Yeah, thanks, Danielle. So going back, like we've been wanting to do this expansion for probably a couple years because we got to a point here in BC where things were like during COVID, it really allowed us to like work on a lot of refining like our systems, our processes. Like we had time, we built out like a whole standard operating procedural manual. We, you know, developed our onboarding process. Like we kind of got things running real smooth, and we're like, okay, great, what's next? And we tried a little bit to expand to different cities in BC. We had a physio in Kamloops for a couple of years, but it was just super part time. And then she moved to Toronto, and we couldn't replace her. We tried recruiting Victoria pretty hard for about a year. Like, I think we had like maybe a couple applicants, but they weren't the best fit. And then I just thought, I don't know, it just kind of hit me. I'm like, maybe we should just go for like another new market, like a bigger city, like new market. So we
Mhm,
did.
mhm,
We had our director of operations, Katie, who's been working with me for about 7 years. Is originally from Calgary, and she's
mhm.
like, I think we should go to Calgary. And I'm like, okay, yeah, sounds good. And then we just thought like it is like proximity wise, it's like our neighbor, Alberta's our neighbor. For me as an owner, I thought like it's not too far. Like I can fly there pretty easily and quickly. And also I knew a lot of people in Alberta, like a lot. I have a lot of friends who own clinics in Alberta. I also just know a lot of people in the clinic owner community who
Yeah,
operate businesses in Alberta. So one of the first things I did when we decided to go for it, well, not fully go for it, but I actually got on the phone and, I made a list of about 8 or 10 questions. And I just reached out to probably 6 or 7 friends of mine in Alberta and just asked them like a bunch of questions. Because I wanted to see, like, I just want to learn more about what it was like, operating a physiotherapy practice in Alberta. I mean, none of the people that I knew were mobile, so they were all like clinic owners, but still, they'd been in business for a long time and knew a lot. So part of it, there was like a few different reasons, like just mainly those reasons. And then once I kind of had my calls and, I discovered from my friends there that, yeah, there's people there doing it, but they like a lot of them are like, I don't know if there's really like that many people doing it, or they were like their gut feeling was like, I think there's potential. Like I think you could probably have success here, like why not? So at that stage, I think the big thing too, just to backtrack a bit, is in wanting to like again, like our team coming to me like, Justin, we should take this to other cities. I'm like, yeah, great idea. Let me think about it. Um, and that got me excited. But I also knew um that it was probably going to be like I would need to be involved. Like you can delegate and you can delegate only so much. But when it comes to a lot of the like, especially the legal and regulatory side of things, it's typically the business owner that has to do those things. So
The risk falls on you,
um,
so yeah.
yeah, yeah. What we did is so I had to get essentially what I'm trying to say is I had to feel like I was in a good position to commit to this. Like I had to feel like, okay, I think I've got like the juice for this or the energy.
Yeah, good
And
for
from
you.
there, we decided to go for it. And so we made it kind of like we tend to live our lives in quarters here at Chipperfield. So we decided to kind of make it a quarter 4 2025, quarter 1 2026 rock. And we built it out. We did our best to build it out. I mean, this is where like my team is just amazing. Like Katie and our assistant clinic director, Gary, and we started meeting like weekly. We set up like a regular meeting rhythm once a week on Thursdays. We'd usually meet for about 60 to 90 minutes. And we just basically created like a big task list in Notion with okay, like who's gonna do this, who's gonna do that. Like obviously we all have our strengths and weaknesses. So we just tried our best to look at like between Gary and Katie and I, um, divvying up the tasks and to do items, and we just started chipping away at them, like just really slow, and it was slow and gradual, and um, we started to gain momentum a little bit with it and get excited about it.
That's awesome.
You know, the next step once we started to get closer was finding a physio, right?
Yeah.
We had a feeling that would probably be our biggest hurdle because, in talking to my friends in Alberta that own clinics, they did share with me that it is also like really challenging to find good people there, like strong candidates. Um, Again, boy, we really lucked out with Rebecca. Like I had 3 calls with her. um, then, she came to Vancouver and we had a lunch meeting, and she committed to working with us. And one of the big learnings that we had there was it took time. So it took, from the time we started the process to the time where Rebecca saw her first client was about 5 months.
Wow.
And so just even getting the final step and all clear, so to speak, was getting the approval from the college. Like we did, it was quite involved, to be honest. Like we like I as an owner had to do like a lot of learning modules. I had to do an exam. You have to appoint a most responsible physiotherapist. They also had to do all those learning modules and do an exam. And so it was like they really requested a lot of information from us, like a lot of information on our privacy policies. Um, they really did a deep dive on like our website and our marketing and our social media. And they're very like their compliance is quite high there. Like it was. I mean, I set up my corp quite a while ago in BC, so I don't know if that's changed recently, but certainly in Alberta, it was a lot more work, to be honest. And then once we like even with the contract, like we had to create like one of the pieces was meet with a lawyer in Edmonton and help us create a new contract in Alberta. And that was even like a massive learning experience for us. Like it was quite a bit different from what we have in BC, even working with like an employment lawyer here in BC for 5, 6 years now. So that was another thing. And then the college reviewed that contract and they came back with us to us with like edits and revisions. And like we were going back and forth with the lawyer. And I was like, wow, really? Okay. And so all the while we're just like, we're kind of ready to go. Like we've got our market, like the marketing plan, working with our marketing coordinator, like we are ready to launch. Like we are like itching to go, but we're still kind of waiting for this like final approval. And then it took a while. Like even after we submitted everything, I think it was like 6 weeks. And
Wow.
so Rebecca, our physio there, she was like, had already left one of her other jobs to join us. And meanwhile, like, I'm like, okay, well, no word from the college yet. Like, hopefully soon.
Hang tight. Yeah.
Yeah.
So did you have to
So,
get a license, like an Alberta license, and then an
yeah.
Alberta.
Oh yeah. Yeah. I had to sit up. Like, the corp side of things, like doing the registration, that was pretty easy. That was pretty quick. Like it only took a few weeks. I mean, I did have lawyers help me with that because I'm not like the best with that stuff. But yeah, just a lot of little things to do, right? And then just
Wait.
getting
Yeah.
getting that first, getting that like getting the email from the college, like the approval, was just like literally tears of joy, like jumping up and down.
Pop a bottle.
I think like we had 2 or 3 clients that were like already on Rebecca's waiting list. And so just to be able to like get them in, get Rebecca to see them was just like, oh, thank goodness. Yeah.
My goodness. Okay, so when did that approval actually go through?
I think it was like the beginning of February.
Okay, so now
Yeah.
it's been a couple months and it's obviously growing, I assume, and, you're
Yeah.
happy with the decision, like it was the right
Yeah.
move? Yeah.
It's so great. Like it's so exciting. I honestly feel like a startup again. I'm going to Calgary on Sunday again next week. It'll be my third trip in about 2 months. So
Amazing.
I've been going to like just get to know people in the business community there, people in the rehab community, doing like networking, like old school marketing, like literally cold calling people like, hi, my name's Justin. I'm in town from Vancouver. It's just, we're working on setting up a new business here. Is there any chance you have time for me today? Like
Wow. Good
literally
for
like
you.
just reaching out to anyone and everyone we know. We have like a whole obviously spreadsheet and template of like contacts and connections that we're really trying to just build relationships there.
Yes.
Right. And that those take time and energy and commitment. And fortunately, Rebecca has really, really stepped into this role of kind of being the most responsible physiotherapist because
Yes.
she actually has a lot of responsibility there, like a lot. And I'm so grateful that she was willing to like accept that and take it on and really, you know, she knows that she's like the face of our franchise in Alberta, essentially, right? And she's been doing like a lot of talks in the community and like she's giving a talk Monday. I'm gonna go and join her on Monday. And I'm just like, it's just so exciting.
My gosh. Congrats. That's so cool. And I really appreciate the like feeling like a startup again. I feel like all of us who are entrepreneurs sometimes crave that. Like we crave a new challenge sometimes.
Oh yeah. We're wired fairly differently, I'd say. I
Yes.
I don't want to say I was getting bored, but I think I was ready for like a new challenge. Like
Yeah.
11, 12 years in, I'm like, I like the cool thing is, I think I shared this with you, before our call, is that I've been able to get to a place with my business in the last year or so where there were like 2 blocks of time last year where I took, 2 months off, like completely. I think I had like one meeting a month with like our key, admin team just to kind of get like any updates or um just to be like feeling like I'm still in the loop a little bit on things.
Totally. Yeah.
Being able to like fully step away was amazing, and it taught me that I yeah, hopefully I bring value and there's things that I'm good at and that I can do, but also like the business isn't relying on me. And it allowed me time to like daydream a little bit more about,
Yeah.
oh, I wonder what else is out there for us and just like read books and listen to your podcast more. And, um, just like, yeah, and take better care of like my physical and mental health as well. Like just, getting when you're always on and firing on all cylinders, it's challenging.
It's
So
a lot. That cognitive load is really it's hard on the body. It really is, like,
yeah,
sleep is affected, just, like, stress levels, cortisol, heart like, all of that stuff, like, that cognitive load is
yeah,
it's a lot. It's a lot. Good for you. That's I
yeah.
love
I
it.
mean, I got to give like huge props to our team because I kind of gave them a heads up that I think I was, essentially burning out for lack of a better word, and they're like, okay, what do you need? Like, we got you. Just
Yeah.
take as much time as you need. And I'm like, really? And they're like,
Okay.
oh yeah, I'm like, are you sure? Like, you guys good? And they're like, oh yeah, we're good. We got
Yeah.
this. Like, yeah.
I love it. I love it. Well, and I know you've also mentioned that you've worked with a lot of coaches over the years too. I'm really curious about like what coaching looks like for you and how you've kind of integrated that into the wellness side of things for yourself.
Yeah. Oh boy. Where would I be
Are we
without
opening up a
coaching?
whole other
I think I remember Andrea. I think it was over Andrea or Anakin being like, spent a small fortune on coaching.
Yeah.
Yeah, that's me too.
Yeah.
But I remember like, I've had three different coaches now in 10 years. I had first coach I worked with for 7 years, then another guy for a year. And I've been with this other lady now for 2 years and honestly don't know where I'd be without it. Have to give like huge, huge props to the coaches that I've had.
Mm,
Yeah.
I love that. What are some of the biggest like takeaways for you that have or like the biggest transformations or what's the right word? I mean, maybe you can just maybe you picking up what I'm throwing down. What are kind of the
Yeah.
biggest like lessons been that you've integrated through coaching?
Oh man, there's so much. There's so many. I think the biggest one early on was just getting into a different mindset. Um, like I think I was like stuck in some old mental models, like ways of thinking. My coach, I would say something and she'd be like, where's that coming from, Justin? I'm like, I don't know. That's a good question. So
Interesting.
honestly,
Yeah.
just like getting to know myself better. Um, and also just like helping to grow like my leadership skills. That's been a big part of it. Helping with like the business side of things. Really, I've had like all my coaches are like really strong and experienced on business. And, like we were talking about before the call, I don't have any formal business training, no MBA, like nothing. I'm a physio, and I've had to really learn how to be like a business owner and step more and more into like different stages of leadership. So I think just being able to bounce ideas off each other. I find like good coaches ask really good questions and they just get your wheels turning and get you thinking. So whether that leads to, I've really over the years picked up like a lot of healthy habits as far as journaling, reflecting, learning more, like having more of a growth mindset and an abundance mindset versus
Mm,
like a fear and lack mindset,
yes.
which is where I used to live.
Yeah.
I still visit there every now and then, but
We all do.
I try not to. Yeah. So just I think the mindset shift is the biggest one. And I specifically worked with one coach a few years ago who I knew was a really successful clinic owner
Mhm.
and that he was really good with on the financial side of
Mm.
things.
Yeah.
And that was probably where I was weakest. And that's where I really wanted to learn from him more about like how to read a profit and loss statement and a balance sheet and learn more about how to become more profitable. And I mean, there was obviously other things we worked on, but
Totally.
I knew that he was like a real whiz in those categories or whatever, right?
Yeah.
So I learned a lot from him, and it helped. Like it really helped, you know. So I think the coach we're working with now is amazing, and for about one of the really neat things too is for about 5 years now, as we've grown, I've really gotten whatever coach that I've worked with, I get to work with our team. So
Mm.
with our senior admin team, as well as our clinical leaders. So they are also receiving coaching because like I know quite a bit. I've learned quite a bit. I know quite a lot. I at some point you get to a stage where you're like, I feel like I've given almost everything I can that I have to offer here to these people on my team. And what else can we bring in to like help us level up?
Yeah,
And that's where I think
absolutely.
working with um, a few different coaches over the years. And I think the thing is too is that as your business changes or maybe as you grow and as things change and shift, you may need to shift to a different coach or person to work with. And that, I remember when I had that first coaching relationship for 7 years, it was really hard to move on from there. But I knew in my gut that it was time.
Yeah, and you trusted that, absolutely. And yeah, like, different phases call for different, areas of coaching. Like you said, at that phase, financials was a focus, so it was like, yeah, let's focus on getting some coaching around that, and yeah, then maybe it's more around different aspects of leadership, and I love the fact that your team is also involved with it too, because then it also kinda gets you all on the same page, like, you're all learning the same material and speaking the same language, having a similar mindset around things, like, I think that's also really important to be in tune with each other that way.
Yeah. Yeah. So I'm super grateful for all the coaches I've worked with and including our current coach is just, it's just amazing. Like
Ugh, it's
I
clicking.
if there's one piece of advice I'd give to, like young business owners, I'm like, I always ask them like, are you working with a coach? Like, are you getting any coaching? Because I don't know. Yeah. It's just been super helpful for me personally.
That's amazing. What other, like, resources or books have been really supportive or had a big impact on you in your leadership?
Yeah, there's a lot. I mean, it's a big long list now. I'm pretty obsessed with these things. I started out right from day one, reading several good books, and over the years, I continue to, usually my goal is to read about 12 books a year, whether that's audiobooks or paper. Lately, lately I've been really enjoying, like, Ryan Holiday's books.
Mm,
He's
stoicism.
the Daily Stoic.
Yeah.
So I've read almost all his books now. I went to see him speak live, last year when he was in Vancouver. Just love like, there's it's just a different way of thinking again, like the
Mhm.
stoicism stuff.
Yeah.
Some of the books, like, in the early days that I read that, I sometimes recommend to people who are just starting out would be books like The E-Myth, Built to Sell, because I really wanted to learn on. I knew early on that I wanted to build a business that, didn't necessarily fully rely on me and that could give me some freedom, either of time or money, and that I could sell someday. So I needed to learn how to do that. So books like Traction
Mm,
really helped.
yeah.
Um, Start with Why. Like, I'm a huge
Yeah.
Simon Sinek fan,
Yeah.
huge Gino Wickman fan. I mean, Jim Collins.
Yes.
These are just some of the authors that I love, and
Yeah.
I'm always open to like learning about more like new books and booker. I've always got a list in my phone, like
Yes.
books to read, right? And
Me
yeah,
too.
so
Me too.
uh,
I
the
know
book
that
that
because you mentioned the spots on the bus, and I was like, "Oh, he's read Jim Collins, that's good to great."
yeah, yeah,
One of
totally,
my personal favorites as well, that book is, like, I think that book is, like, essential reading for anyone who's going to start a business. That's, like, Startup 101 right there, that one for sure.
right? Yeah. Or even like a book like Think and Grow Rich, like Napoleon Hill. Like it gets you into like such a different way of thinking and a different mindset.
And I think that's just it, like, a business mindset is not something that's obvious or like always going to be innate for people. So sometimes like having those external inputs is just going to help you be in that mindset if you are going to open a clinic or open a business. So yeah, I mean, this is a great segue into any other advice or like if new grads, clinic owners ask you about starting a business, like what's your advice to them?
Yeah. Well, I always ask them why they want to do it. And then
That's
I just
huge.
listen.
Yeah.
And there's no wrong answers. Everyone's why could be different, right? But I'm always just really curious about that. And I think, obviously hindsight is 2020. I have worked this out. Like but I literally started out with like no plan, no coach, no knowledge, like not really like I went in pretty blind. So, you know, when I have conversations with young entrepreneurs now, I am sort of encouraging them to start thinking about not only why they want to do it, but what is their kind of long-term vision of owning a business? What is their long-term goal? Like what do they want to get out of it? Um, and then from there, making a plan, like even if it's a loose, it doesn't have to be like a super structured like business plan, although sometimes maybe those are helpful. Like especially if you're opening a brick and mortar, I think like to have the more planning and detail you can, the better. Um, but yeah, just having like a bit of a plan, I think would be great. And then just going for it, like just commit, like just, it's the hardest part is just starting. So just like start, just do it.
I love it. Start with why, make a plan, and go for it. That
Yep.
seems pretty
Pretty much.
straightforward. What's next for the business? What's next for Chipperfield?
Yeah, I mean, we're
Saskatchewan,
really,
Ontario?
yeah, definitely. We're in growth and expansion mode. Now that we've gone to Calgary and Alberta, we have excitement to go to more cities across Canada. Although, this expansion in Alberta has really it's been a great learning experience, and we continue to learn. And I think what it's taught us is that I think we've done it. It's going well. But when I think about right now going to like another province, it's a bit daunting, to be honest. So just sort of like not in any big rush, but all in good time. And also like I'm meeting lately with more people who have done this. So again, like just I'm a social learner, so you can read, like I'm reading a book it's called Scaling Up right now. So like books help, but also just talking to people who have done it and kind of learning from them and how they did it and what they learned is next, is happening.
Yeah, that's amazing.
Mhm.
Justin, thank you so much. I have one last question. I feel like I've learned so much. I'm like taking notes in my brain right now through all of this, but I have one more question for you. And before I ask it, I just want to, is there any other thoughts or things you want to share within all of this? I feel like I'm like so blown away by so much of what I've learned today, but anything else, any last thoughts you want to share before I ask you the last question?
I mean, not really. I just want to say, like, thank you so much for having this podcast. I know I've told you before, but it's been really like educational for me as well, even though, I've been in business for 13 years, but I think it's just much needed, long overdue. I've learned so much from like the other guests on the podcast. So super grateful for that.
Thank you. Thank you. I mean, it's been honestly, it's been such a like I get to literally spend an hour or 2 with these clinic owners and take in all this information from them, and it's like my way of like picking people's brain and like get like I just it's so incredible for me. I've learned so much and I'm so fortunate
Yeah.
that I get to have these conversations. It's wild to me.
Yeah. No, I've really, really just thoroughly enjoyed learning more from other people who are like running businesses and physio businesses in BC. It's been very educational and enjoyable, and just feels like you get to know people, a lot of the people that you've had on maybe I've met, but I don't know them that well. And you just get to know them better. And I think it's like common humanity. We're all in this together. It's clinic business ownership can be a bit of a roller coaster, and it has its challenges. So the fact that you're bringing people together in the community like this, I just give you like huge props.
I I enjoy it. It's been amazing for me. So yes, the last question, and I think you know what it is, what's coming. Given the name Health of Business, what does a healthy business look like to you?
Yeah, such a great question. And obviously, yeah, I've had time to prepare for this one. And I'll try and keep it as, succinct as possible. But I think the big one too is just like I think about it from a financial side of things, like being able to make payroll and not going into the red. Amazing. Like, wow, what a relief. And that's only been for a few years for us, to be honest. And to take it one step further, like, oh wow, okay, can we be profitable? Like leaning into um not being shy about being like, okay, I actually want to, we're running a business here. Like we're not a nonprofit. Like let's try and make some money, right? So, um, being financially healthy and just learning more about like the financial side of things and being more like literate in that regard. Like, you know, started having instead of quarterly meetings with my accountant, we shifted to monthly meetings a couple of years ago, and it's just allowed me, and started to involve like our clinic director, assistant clinic director, and director of operations in all of those meetings. So they're also learning like the financial health of the business, um, which has been huge. And then I think at the end of the day, always want to really create like an amazing workplace where, say, like Monday morning rolls around and people are excited to go to work. Like it's like just a healthy, supportive work environment that people can grow and thrive and learn. They can have mentorship and support as much as they need, and they can also work independently. So, kind of finding that balance. And
Yeah.
then, of course, I've always felt that if our team is happy and they're thriving, then they're going to show up better for our clients. And
Yes.
we're going to have our clients are going to have better experiences, and they're going to get better outcomes. And the clinicians are going to feel more of like that internal reward.
Yes.
So just, taking
Positive
really good,
feedback.
yeah, like taking really good care of your people, um, being honest and transparent, and also, having fun. Like we're all grinding
Right.
and working hard, but we really, one of the challenges with the mobile business is that we don't have a brick and mortar. We don't see each
Yeah.
other as often or regular as we maybe like to. So we make a point of like having quarterly socials where we get together. There's always going to be really good food. We're really big on the good food and the good
Love it.
drinks. And more lately, we're trying to like just have more fun, like do more fun things, like mix it up a little bit.
I
So
love it. Oh, I love it. Well, and something that like comes to mind too when you talk about having healthy financials, like I think a lot of us go into this job and feel like it's a very altruistic job. Like we're empathetic and we're giving. And, there's not a lot of people who like I think if you start a business and take that risk, there is no reason for why you can't make a profit. And having a profitable business allows you to reinvest into those fun things and into, all of that as well, right? Like that leads to having a happier, healthy team when you have more financials available to do the fun, educational growth type things. So yeah, I get
you
it.
nailed it. Nailed it.
Justin, thank you so much. I have learned so much and I mean, I want to come to one of these parties. So
You're welcome to anytime.
thank you.
It's
Um,
it's been a real pleasure. Thank you so much for having me on the podcast.
thank you for your time today. I learned a ton. So I feel like there's a 2.0 in this as well. I know there's a whole set of topics that we haven't discussed today, but I'm going to leave that one mysterious and we'll do a 2.0 when I pick up recording again in the fall.
Sounds good. Thanks, Danielle.
Thanks, Justin. That's it for this episode of The Health of Business. If you're navigating any of these challenges in your own clinic, know that you're not alone. If you're interested in working together on any of these challenges in your business, head to danielleboyd.ca to learn more about my consulting offerings and to get in touch. Catch you next time on The Health of Business.